Good morning, everyone. Thank you for joining us here today. And I'm pleased to be here with Dr. Anna Nielsen Williams, who's the Chief of Psychiatry for the Bermuda Hospitals Board, as we share the key findings and recommendations of the recently completed first phase of work relating to the acute adult mental health integrated care pathway initiative. This will not be the first time that you have heard me speak on the importance of ensuring that all residents have access to quality and affordable health care, and this includes care for those experiencing mental health challenges. The need for holistic and integrated mental health support continues to grow, and I would dare say that most members of our community know someone who is, or they themselves have been directly impacted by mental health challenges. It is for this reason that the acute adult mental health was selected as one of the first 3 clinical areas of focus for the Ministry of Health's Integrated Care Pathways Initiative. An integrated care pathway is a multidisciplinary approach that details the essential care steps for people with specific needs, and in this case, adults experiencing mental health challenges. The pathway specifies the care provided from beginning to end and defines what happens when and who is responsible at each stage of the care journey. The Acute Adult Mental Health Integrated Care Pathway Initiative is one of the 3 undertaken by the Ministry of Health in 2023, in addition to pathways that have already been completed by the Bermuda Hospitals Board. And its work was driven by a multidisciplinary working group led by Dr. Nielsen Williams and supported by KPMG. The initiative provided the opportunity to better understand the current provisions of acute mental health services here in Bermuda, understand the patient's experiences of the available services, and to identify both challenges and opportunities to be addressed or capitalized on to ensure an efficient, effective, and patient-centered care that is reflective of best practices. Over a 16-week period, an extensive literature review was completed, including the review of over 20 studies, reports, and databases. In addition, broad stakeholder engagement was foundational to this understanding. 52 interviews were conducted with patients, family members, clinicians, mental health experts, law enforcement agencies, judicial representatives, and community members. A community-wide survey was also undertaken, and it received 348 responses, providing 1,117 qualitative inputs. 3 stakeholder workshops were facilitated, including one with patients and families with lived experiences. Participants also included clinical specialists, nursing staff, primary care physicians, allied health professionals, diagnostic professionals, family and social services, health visitors, and the nonprofit sector. We are truly grateful to all of those who responded to the call for feedback, especially those patients and families who are willing to share their direct experiences on such a vulnerable aspect of their lives. The level of engagement on the part of the public was excellent. People were keen to connect and help formulate recommendations for improvement. This first phase of work on the acute adult mental health integrated care pathway has surfaced those areas where collectively the government, mental health service providers, and community-based organizations can come together to improve access to essential mental health services and to strengthen the overall support for adults in Bermuda who are struggling with acute mental health issues. 30 key challenges were identified in relation to the provision of acute mental health services on island. Not surprisingly, this body of work confirmed the need for mental health services in Bermuda is high and has increased since the COVID-19 pandemic. However, as in the case in other countries, mental health has received less policy attention than other health conditions. This work begins to address that state of affairs and creates a clear pathway for how to move forward. The report coming out of this integrated care pathway work makes it clear that systemic change is required to address the existing gaps and opportunities with mental health support. 7 areas for policy intervention have been identified, along with 30 recommendations to improve the pathway and significantly improve the mental health outcomes. At this time, I would like to invite Dr. Anna Nielsen-Williams to share with you the key findings and recommendations of the working group, after which time then I will then discuss the next phases of work for this care pathway.
Thank you, Minister Wilson, and a very good morning. It is a privilege to share the results of the initial work undertaken on developing the acute adult mental health integrated care pathway. The approach was taken and thoughtfully developed and implemented to ensure the best possible outcome in the long term for our community. The process itself, with stakeholder workshops and interviews, cultivated a stronger level of collaboration between services. The overwhelming response to the public survey really reflects a high level of interest in mental health. Importantly, the stakeholder workshops, interviews, and surveys also created the opportunity for the voices of those with lived experiences and their families to be directly heard and their feedback incorporated into the findings and recommendations. The importance of the learning that came out of this cannot be overstated. I don't think we had really initially appreciated how complex it was for people to enter and receive mental health services and support in Bermuda. There are currently 21 different access points for people to enter into the care pathway, which then makes the coordination of care a challenge. Working together to create an integrated care pathway for acute adult mental health provided an opportunity to discuss the ways in which services could be better coordinated with the patient and the family's experience in mind. This exercise also helped point to important service gaps, mainly around prevention, community care, and housing. The unfortunate reality is that mental health carries with it a stigma, one that is all too often acting as a barrier to those suffering with mental health challenges and seeking out the support that they need. One of the two main barriers to accessing mental health care in Bermuda that was identified was around stigma, and the other was cost. The inability to cover co-pays within the primary care setting, or in the case where an individual has no health insurance, the total cost of service and/or medication represents an overwhelming barrier to accessing care at that level in Bermuda. This prohibitive cost forces people to wait before they receive care and can result in more acute health situations that require, unfortunately, more intensive inpatient treatments and services, which is both very costly and also very difficult for patients. Our work surfaced important service gaps in Bermuda that need to be addressed. As an example, there's currently no public early intervention mental health services available in the community. There's also a lack of adequate housing options following hospital discharge, and this can lead to poor patient health outcomes. The final report highlighted 7 priority areas for intervention, including designing and implementing public preventative and early intervention services, expanding information about existing services, raising awareness around mental health and addressing issues of stigma, ensuring privacy of services, integrating mental health assessment and care into the community, improving insurance coverage for mental health related expenses, and lastly, striving to improve and provide culturally appropriate care. Bermuda's annual mental health expenditure per person is significantly higher than in other jurisdictions, and the 20 final recommendations included in the final report do represent opportunities to improve patient experience whilst in the care pathway, along with also offering much needed cost-saving opportunities. All are important. However, I'd like to highlight the following 3, which represent considerable opportunities for Bermuda to improve the health of its population. It is further recommended that a public repository of mental health resources be created to ensure that our members of our community can easily find what mental health services are available and where. Second, a national mental health strategy for Bermuda be developed. And lastly, a one-stop shop, a clubhouse be opened within Hamilton, which is a community-based centre designed to create a more supportive and inclusive environment for people who have lived experience or mental health challenges can come together, socialise, learn skills, and access various services in this setting. There has been increasing public sentiment around the need for mental health to become a key public health priority. And this initial work of the integrated care pathway for acute adult mental health is a recognition of the need for improved mental health care. It's provided a springboard and an initial way forward for all stakeholders to continue working together to strengthen this component of Bermuda's overall health system. Before I hand back the microphone to Minister Wilson, I really wish to express my personal thanks to everyone who was involved in this work to date, in particular those with lived experiences and their families. Without the willingness of all stakeholders to engage in transparent conversation and debate, we would not have been able to develop the future state care pathway and its service map. It has been and will continue to be my privilege to work alongside both my fellow working group members, the diverse group of stakeholders as we continue this journey to strengthening mental health care in Bermuda. Thank you.
Thank you, Dr. Nielsen-Williams. Again, as I indicated, this is the first phase of work on increasing access to and strengthening the provision of mental health care in Bermuda. It is a priority for the government and fellow health sector stakeholders. And the reality is, however, that this will not be a quick fix. To ensure momentum of this work continues, a working group is currently being formed to drive the next phase of work. This will include actioning the priority recommendations identified in the integrated care pathway. And it is important to note that the government cannot implement all of these recommendations either alone or all at once, nor can it be implemented by stakeholders working in silos. A holistic and collaborative approach is required between the government, mental health service providers, community organizations, and other key stakeholders. We are committed to facilitating an environment where productive solutions can be developed and implemented for improved access to and quality of mental health support. Already, one of the organic outcomes of this working group coming together was the creation of the Alliance for Mental Health Advocacy, or AMHA. This group aims to safeguard the rights of individuals grappling with mental health conditions. And Ms. Barbara Belton Brown is with us this morning as a representative of this alliance. Thank you. We look forward to engaging with this group. It's a very important group, and all of our other mental health stakeholders. The Adult Acute Mental Health Pathway outlines strategic measures to enhance access to mental health services, strengthen support systems, and reduce barriers that individuals facing mental health issues in Bermuda may encounter. It is a testament to our government's determination to foster a society where mental health is a priority, destigmatized, and seamlessly integrated within the broader healthcare framework. The report on the Acute Adult Mental Health Integrated Care Pathway will be made available following this press conference for download on www.healthstrategy.bm. And I urge members of the public and the community at large, as well as all stakeholders and persons interested in this particular important initiative, to take the time to review the findings and the recommendations and be a part of the journey of strengthening this aspect of Bermuda's health system. Before closing, I too want to express my sincere gratitude to the professionals in the mental health sector, the community partners and stakeholders who have contributed their expertise and insights to the development of this pathway. Your commitment has been invaluable, and together we are forging ahead of a path towards a more compassionate and resilient Bermuda. As we move forward, let us embrace this moment as a catalyst for positive change. I encourage open dialogue, collaboration, and active participation from all sectors of our community during the implementation process. Your input is crucial in shaping the final stages of implementation, ensuring that the adult acute mental health pathway aligns with the diverse needs of our population. Let us collectively reaffirm our shared commitment to building a healthcare system that not only promotes physical well-being, but also nurtures the mental well-being of every individual. Together, we are laying the foundation for a Bermuda where healthcare is truly universal, leaving no one in the shadows of neglect. Thank you very much.
Thank you, Minister. Thank you, Dr. Nielsen. We will now invite the media to ask questions. We'll start with Bermuda Broadcasting.
you, Elisa from Bermuda Broadcasting. My first question is, you noted that the findings confirmed that the need for services is high on island. Did you receive any indication of just how many residents are experiencing mental health challenges?
Thank you. So absolute percentages, I think, are difficult for us to fully understand. But working within BHB and understanding the number of touch points, the referrals that we're receiving, the number of admissions, and people from really all walks of life that maybe would not have necessarily accessed our services before, I think that speaks to the need, as well as the response rate to the survey. I think people are genuinely really interested and really have strong opinions around what mental health looks like on the island. So I believe the need is there, but absolute quantities we don't have exactly at this moment.
Understood. And did the findings indicate whether the high need for mental health support is putting a strain on existing services at all?
I mean, I think, we recognise that mental health throughout the world with COVID has had an impact. And my impression is that's in part the reason why we've had so many people accessing and looking for services. There is always the need for service delivery and development, and we're working closely with the ministry around that. And we are certainly advancing making recommendations around where we see the needs lies, and working very closely with the ministry.
Thank you. And Minister Wilson, you noted that this is phase 1. Just how many phases are there, and when can we expect the recommendations from the working group begin to be actioned?
Okay, I'll pass it on to Dr. Nielsen with respect to the number of phases, but I think it's important to note that, as you've indicated, this is just the first phase, and there are a number of recommendations, and we're looking to enhance and to advance some of the touch points that are medium and short-term resolution, because right now, as you can appreciate, the government is exercising the strategic, health strategy, which has 8 particular principles that we're trying to advance, one of which is universal health care. However, this is also a very important aspect that we need to advance, and there are certain recommendations that are coming from this particular strategy that will be short and medium term, which will be helping to advance.
Thank you. I echo the Minister's remarks that essentially this is the beginning of the journey in terms of our collective work. And I think something that came out of the number of stakeholder meetings that we had was really around that there are many people in the community doing really good work within mental health, but we're not necessarily all working coordinated well together. And having everybody around the table from all the various backgrounds, I think that created a very strong position and a very unified voice. And it was very transparent. Everybody spoke openly around what their concerns and their impressions were. But we all had a universal striving to improve the mental health care services on the island. So there was certainly a collective goal. And this is just the first step in more to come, essentially.
Okay. And it was noted that the barrier to cost is one of the main challenges in accessing mental health services. And research shows that poverty increases the risk of mental health problems. How will this pathway ensure that Bermuda's homelessness population and others who are most vulnerable can access services?
Thank you very much. That's a very important question. You'll appreciate that there's a number of dynamics in that, and the government is working in tandem with other organizations, community organizations, to look to address the homelessness issues in Bermuda. However, from a broader perspective, recognizing that once we start absorbing what the recommendations are, it will give us further information and input as to where the challenges are in this in our community, where the gaps lie, so that we can start working towards plugging those gaps. Again, it is not going to be an easy fix. It's not going to be a switch the light and we'll be able to resolve all the issues. But I think the most important aspect, or the takeaway from this, is that it's a collaborative approach. And as Dr. Nielsen said, we have now had all of the stakeholders involved in this exercise so that we can all work collaboratively with one goal and one mission in mind, and that's to advance the cause, destigmatize mental health, and to provide the services and gaps that may exist to help to address our population.
Thank you very much.
Okay, we now invite questions from the World Gazette.
Good morning, Haley Morrison from the Royal Gazette. Oh, okay. Minister Wilson, just talking about service gaps, related to the repurposing of Bridge House, and hopefully in terms of, into housing programs and support for people with mental health challenges, can you speak to the fact whether this will be integrated into what we were talking about today? Is this one of going to be part of gapping the problem with mental health challenges for people?
Okay,
Who,
I'll pass to Dr. Nielsen. I'm glad that you know about Bridge House. You've just been here for a moment, but you know, it's a very important initiative.
Thank you for the question. So the movement of MWI inpatient services, essentially for the longer term, long care needs of our population into the community, is a pillar of our MWI Directorate plan that we've obviously gone through our second year. We're very pleased that we've been able to successfully launch one group home within the community called Tar Heel, which 8 individuals who had been residing for a very lengthy period at MWI have successfully moved to this home. It's been in existence for over a year now. It's been well received and well integrated within the community, and they are living meaningful lives in a very normalised way. The second phase is the opening of the vestry Bridge House, which you mentioned. We're anticipating this to be ready in the spring, and that will again service the needs of beginning with 8 individuals, again individuals who have resided at MWI for a very lengthy period, but really with our current philosophy and thinking from a moral and ethical standpoint, there is no real need for them to remain within MWI. The ultimate movement is towards the community, but it's been done in a very carefully planned and managed way with very careful consideration around which individuals would be the most appropriate to move. So the trajectory is towards the community, but it's been done closely with the ministry along with careful consideration around ensuring that we're selecting and identifying the right individuals.
Okay, thank you very much. And just later, I'm sure this will be available online, but just curious, the survey that you had was 348 responses. Can you just speak to the fact in terms of the age group of adults that were surveyed, what ages that was?
So I would have to get the exact details, but it was essentially all adult individuals. And yes, the data is available
Above
for
18 to, okay.
18 and above.
No limit, okay. The clubhouse, interesting. So in terms of the conversion, in terms of redeveloping that for people suffering from mental health issues, is that also going to be for children, or is it just focused mostly on adults?
So the initial thinking would be that it would be for an adult population. And the clubhouse model is something that's been around really for actually many decades and proven very successful. And it's much more essentially run by the individuals with lived experience, that patient population, and really the clinicians are almost the bystanders. It's somewhere where it's a much more relaxed environment. People can come and have something hot to drink or eat, connect with others. Because as you can imagine, with stigma potentially being such a significant issue on Ireland, it can feel very isolating being somebody that may be experiencing a mental health crisis and not knowing, feeling like they're all alone in this journey. So I think the personal connection, and again, we saw that with COVID, I think that's a really important thing. So that's a big aspect of the clubhouse model.
Okay, thank you. That's all my questions.
Thank you. Minister?
Thank you all very much again. And Dr. Nielsen, thank you for your assistance. And again, I'd like to thank all the stakeholders that participated, particularly the patients and the families, that participated in the survey and participated in these stakeholder engagements, sharing their lived experiences. I think that's critically important. KPMG as well for their assistance. So thank you all. Thank you. Who are you pointing to?